Welcome to the video Medication Education and Awareness. In the unfortunate event of an employee injury, BWC and your managed care organization work hard to provide quality healthcare services and return employees back to work. An important part of this process is medication management. Injured workers often need prescriptions or over-the-counter medications to aid in recovery. In this video, we'll explain the employer's role in keeping employees safe while focusing on medication education and awareness within workers' compensation claims. We'll present some general warnings about medications, especially around the management of pain. You'll also learn how an injured employee fills their first prescription, how to identify common opioid medications and understand their purposes and side effects, and the dangers of mixing medications. Many times, an injured employee will receive a prescription before the workers' compensation claim has been filed. In the past, this has caused concern for employees on how these medications would be paid. To resolve this issue, BWC established a program to provide reimbursement for the first fill of prescription medications for medical conditions identified in a pending workers' compensation claim. The first fill program is limited to 10 days or fewer and one drug per therapeutic drug class. No refills will be approved and compounded prescriptions are not eligible. This program guarantees the pharmacy payment so long as they follow the first fill program requirements, even if the claim is eventually denied. If the claim is eventually denied, the employer is not responsible for the cost of the prescription. Injured employees who pay out of pocket for prescriptions can submit a request for injured worker outpatient medication reimbursement, or C-17. If a written prescription was for medical equipment, such as a brace or bandages, and the equipment was paid for at a pharmacy, the injured employee will need to contact the MCO for reimbursement. The management of pain through medication, including opioids, may be one part of the recovery process. Opioids are habit-forming and may cause addiction, so it's important to identify common opioid medications and understand their purposes and side effects. Short-acting opioids are recommended for severe acute pain at the lowest effective dose for the shortest duration needed, typically 3 to 7 days. Opioids are not recommended as a first-line treatment for chronic pain or for employees with a high risk of abuse. Common side effects include dizziness, drowsiness, euphoria, sedation, constipation, nausea and vomiting, respiratory depression, itching, and slow heart rate. Opioids may cause central nervous system depression, and anyone taking opioids should use caution before operating machinery or driving. Listed are some common opioid medications. Opioid overdose is an epidemic in our nation, but many people do not understand the risk. In fact, a 2017 National Safety Council public opinion poll stated 1/3 of Americans surveyed did not realize a medication they had taken was an opioid. Here are some more facts from the National Safety Council that you may want to share with employees. The first opioid prescription may spark an addiction that was never anticipated. After as few as 5 days of opioid pain reliever use, 1 in 5 opioid users runs the risk of becoming dependent and continuing to use opioids 1 year later. This risk increases with each additional day of use. A refill or a second opioid prescription doubles the risk of opioid dependence. Many medications that are generally safe when taken alone may become dangerous when taken with other medications. This includes both prescription and over-the-counter medications. Here are a few examples of combinations that may pose a health risk. Some opioid-based medication may contain acetaminophen. Acetaminophen is a common ingredient in over-the-counter pain relievers and cold and flu medicine. An injured worker may be unaware that taking both medications can create levels of acetaminophen that can be toxic to the liver. Taking an antibiotic for a urinary tract infection can interact with the common muscle relaxant tizanidine and can cause increased sedation. Even seemingly benign over-the-counter medicine like ibuprofen can result in dangerous interactions. For example, both it and prescription etodolac are nonsteroidal anti-inflammatories. Taking too much can cause stomach ulcers and chronic kidney disease. You won't know all the medications your employees take. However, here are some helpful hints to share with employees to avoid dangerous situations. Fill all prescriptions at the same pharmacy so a pharmacist can review all medications and alert you of a dangerous combination. Before taking over-the-counter medications with prescription medications, ask your doctor or pharmacist if it's safe. Never take someone else's prescription medications. Opioids are habit-forming and have a high risk of addiction. Opioids are not recommended as a first-line treatment for chronic pain. Make sure you keep lines of communication open with injured employees. Remember, BWC and your MCO work to ensure that your employees receive the medication they need to recover. If you have any questions or concerns about prescription or over-the-counter medications, we are here to help.